Hello everyone. Hope you all are doing good. So today I will discuss about the another disease condition, that is otitis media. So let's start this discussion with a short introduction of the otitis media. The term is mainly used that inflammation of middle ear means otitis media is this term is mainly used that inflammation of the middle ear. Otitis media is the infection of middle ear leads to otalgia means ear pain, fever, chills, sore throat, hearing loss and respiratory illness. Otitis media is mainly caused by virus and bacteria. So otitis media is a inflammation of the middle ear caused by any virus and bacteria. Then move to the definition of this otitis media. So otitis media is inflammation of middle ear caused by any bacteria or virus with a characteristics by otalgia, fever, sore throat, hearing loss. Otitis media is mainly occur between eardrum, that end of the outer ear, and inner ear, including a duct known as eustachian tube or ET tube. So here we have to know what is ET tube or eustachian tube. ET tube or eustachian tube is a small tube that located from the pharynx to middle ear. It is a connection between the nasal cavity to ear. The main function of this eustachian or ET tube to balancing the pressure between this eardrum. So in this disease condition means otitis media, this eustachian tube or the ET tube act as a main role. Then next is it is most commonly disease in children and does occur in adult also. So here one question is arriving that why the children are more prone to this disease condition. Because of this eustachian tube or ET tube. Because of the children, because of this infants of the children, ET tube is immature and straight line structure. So the disease condition or so the infection or any viruses easily move through this eustachian tube to the ear, and it causes the inflammation in ear. For the adult, the eustachian tube, the structure of the eustachian tube is slightly curved, means it is slightly curved like structure. So for the children it is more prone to this otitis media because of this ET tube or eustachian tube. Next we will see the classifications of the otitis media. So otitis media mainly classified into three: acute otitis media, otitis media with effusions, and chronic otitis media. So I will explain each types of otitis media. So first one is acute otitis media. Acute otitis media, the name only we understood. Acute means the onset of the any infection or the starting of any infection. So acute otitis media when the inflammation of middle ear just started or onset. It is mainly caused by bacteria infection. The bacteria enter by eustachian tube of middle ear. Its rapid onset in inflammation. Cause of this acute otitis media, it is an inflammation process. So main cause the bacterial and viral infection. So bacteria such as that streptococcus, haemophilus influenza, and viral such as rhinovirus and any other disease condition like low birth weight, tonsillitis, tuberculosis, measles, diphtheria and whooping cough. So it is the causes of the acute otitis media. Then we will see the pathophysiology of the acute otitis media. Due to any etiological condition. So here the etiological etiological factors are bacteria or virus. So any bacteria means Haemophilus influenza or Streptococcus, any bacteria or virus, it leads inflammation or infection of nasopharynx. Due to this bacteria or viral infection, it's infect the nasopharynx or the nasal cavity. Due to this respiratory illness, due to this respiratory infections, it's obstruct the eustachian tube, because eustachian tube is a connection between the nasal cavity and ear. It's obstruct the eustachian tube or ET tube. Because of that, the air does not pass due to the obstruction. Because of the obstruction in the ET tube or the eustachian tube, the air does not pass properly. So because of that, increase the negative pressure. Because the obstruction, the air will not pass properly. So because of that, increase the negative pressure in this ear, and because of this increasing the negative pressure leads the effusion and it leads the acute otitis media. Next we will see the various stages of acute otitis media. So the acute otitis media having various stages. So first stage of this acute otitis media is stage of tympanic congestion. So in this stage, the edema and hyperemia of the nasopharyngeal end of the eustachian tube or ET tube. During this stage, patient complain of pain, fullness sensation in ear. So it is the first stage, that stage of tympanic congestion. In this stage, edema and hyperemia of this nasopharyngeal end of this eustachian tube. And in this stage, the patient can complain of this pain and fullness of the ear. So second stage is stage of exudation. In this stage, this name only we understood that the exudation means the accumulate of the exudated fluid. In this stage, the exudate collect in tympanic cavity. Next, the stage of supervision. In this stage is marked by the formation of pus in middle ear, the pain of inflammation, exudate cause necrosis, perforation of the tympanic membrane. Then next, the stage of convalescence or recovery. In this stage, the disease start subsiding and recovery process. Next, last stage is stage of coalescence mastocytitis. In this stage, continue infection in absence of proper therapy cause hyperemia. So it is the stage of acute otitis media. First stage is stage of tympanic congestion, stage of exudation, stage of supervision, stage of convalescence and or recovery, stage of coalescence mastocytitis. Next, we will see the clinical features of sign and symptom of the mastocytitis. Sign and symptom of the acute otitis media. Clinical features or the sign and symptoms of the otitis media. Acute otitis media: otalgia, then tinnitus, hearing loss, irritability, sense of fullness in ear, mastoid tenderness, fever, headache, chill, vomiting, dizziness, vertigo. So this is the clinical features of the acute otitis media. First, otalgia, tinnitus, hearing loss, sense of fullness, then fever, headache, chills, vomiting, dizziness and vertigo. Next, we will see the diagnostic evaluation of the acute otitis media. First, history collection. We should take the history from patient or patient family side. Then physical examination, we examine head to toe, and audiometry and CT scan and MRI. This is the diagnostic evaluation or diagnostic test for the acute otitis media. So next we will see the pharmacological management of this acute otitis media. So first one, antibiotic amoxicillin, then amoxicillin clavinolate or another penicillin derivative plus beta lactamase inhibitors is second line. Antipyretic and analgesic. Antipyretic to reduce the fever and analgesic to reduce the pain. Next, the surgical management of the acute otitis media. First, tympanocentesis. The tympanocentesis and the myringotomy. The tympanocentesis is a procedure to do the puncture of this tympanic membrane and aspirate the fluid. And myringotomy, it is also the procedure to drainage the fluid from the ear. So it is surgical procedure, surgical management of this otitis media. Next, we will see the otitis media with effusion, the second types of otitis media. So otitis media with effusion is also called the serous or the secretory otitis. Secretory otitis media is simply a collection with a fluid in the middle ear space as a result of the negative pressure produced by the altered eustachian tube function. It is also called the glue ear, caused by accumulation non-purulent effusion in middle ear, commonly seen in school going children. Next, the clinical features of the acute otitis media with effusion. Acute otitis media with effusion does not have obvious symptom. Acute otitis media with effusion is characterized by a non-purulent effusions of other middle ear that may be either mastoid or serous. Next, we will see the treatment of acute otitis media with effusion. Antimicrobial agent. Surgery has become the most widely accepted therapeutic intervention for persistent otitis media with effusions, performed by inserting a tympanostomy tube into the eardrum to allow the air pass through the middle ear and help to clear the excess fluid within. So surgical procedure, we have to do the incision to pass the excessive fluid or excessive air. Next, we will see the last types of acute otitis media is chronic suppurative otitis media. Chronic suppurative otitis media is the chronic inflammation of the middle ear with a tissue damage, usually caused by the repeated episode of acute otitis media. Acute otitis may be developed after a prolonged period of time with a fluid or negative pressure behind the tympanic membrane. So chronic otitis media, how it will occur? Because the repeated or the prolonged episode of the acute otitis media. Chronic otitis media develop after long standing inflammation in middle ear and mastoid. So I told before that the chronic otitis media will develop because of the repeated episode of the acute otitis media. Because of that, the chronic will be occur. So it is the etiology of the chronic suppurative otitis media. Then we will see the pathophysiology of the chronic suppurative otitis media is first it start the repeated or the prolonged episode of acute otitis media. It leads the duration of infection is increased. The duration of infection is increased, and it leads the damage the surrounding tissue in ear, and it's cause the chronic otitis media. So this chronic otitis media will start because of the repeated episode of acute otitis media. Then we will see the clinical features of this chronic otitis media. First, persistence, blockage of fullness of ear, hearing loss, vertigo means loss of balance, facial weakness, ear pain, fever, tenderness. Then we will see the diagnostic evaluation of the chronic otitis media. Radiology, CT scan, MRI and audiogram. So it is the diagnostic evaluation for this chronic otitis media. Then we will move to the medical management of the chronic otitis media. Antibiotic and oral toilet. Oral toilet is a process to treat the chronic otitis media. Oral toilet should be performed 2 to 3 times per day just before the administration of the topical antimicrobial agent. So the medical management of the acute otitis media is antibiotic and the oral toilet. Next, the surgical management of the chronic otitis media, chronic suppurative otitis media. First is myringoplasty and myringotomy. So it is a surgical procedure to drainage the fluid, excess fluid, and myringoplasty is a procedure to repair the hole if any hole is present in the eardrum. The myringoplasty is a procedure. It is a surgery or small procedure to do repair this hole in eardrum. So I will summarize my topic. So otitis media is a inflammation of the middle ear caused by any bacteria or virus, and its clinical features, the clinical features by otalgia, fever, fullness of ear, sore throat. The types of this otitis media, the first acute otitis media with effusion, and chronic otitis media. And then the acute otitis media means the onset of these infections, and the clinical features is otalgia, sore throat, hearing loss, then this fever. And the stages is first stage is stage of tympano congestion, the stage of extravasation, stage of suppuration, stage of convalescence or recovery, stage of coalescence mastitis. Then diagnosis is history collection, physical examinations, audiogram, audiometry, CT scan, MRI. And medical management means antibiotic, antipyretic and analgesic. Surgical management is tympanocentesis and myringotomy. And second types is acute otitis media with effusion. It is a collection of the fluid, non-purulent fluid. The clinical feature is like it's don't have any obvious clinical features or sign and symptoms. And treatment is antibiotic, antimicrobial agents and antibiotic. Then next is chronic suppurative otitis media. It is types of otitis media because of the repeated or the prolonged period of the acute otitis media. The cause is the cause for the I told that because of the prolonged or the repeated acute otitis media. Because of that, this chronic the otitis media will occur. Then the clinical features is hearing loss, vertigo, fullness of ear, tenderness, fever. And diagnostic evaluation, radiology, CT scan, MRI, audiogram. Medical management, antibiotic and oral toilet. And surgical management is myringoplasty and myringotomy. So it is all about otitis media. I hope you understood this topic. Thank you all.